Today we're going to talk about BPH, or as most people know it, enlarged prostate. Now BPH is benign. It's not cancer and it doesn't become cancer. But prostate cancer and BPH can coexist in the same patient. BPH is very common. About half of men 51 to 60 have some BPH, and by age 80, most men, probably 90%, have it. So what does the prostate do? Well, the prostate is part of the male reproductive tract, and it provides fluid into the semen for the sperm to do its job. As men age, though, it can enlarge and almost inevitably enlarges, and that's what causes the symptoms. When the prostate is enlarged, it can cause symptoms of blocking off the urinary tract that's manifest with hesitancy to urinate, straining, poor flow, and incomplete emptying. Men can also experience irritative urinary symptoms like day and nighttime urinary urgency and frequency, which is especially bothersome at night. Men may progress to complete inability to urinate, which is called urinary retention. They can have urinary tract infections, they can have bladder stones, and they can even do damage to their kidneys. BPH can also cause blood in the urine, but it's not necessarily the cause. What causes BPH? We're not exactly sure, but we do know you need two things. You need to age and you need to be a man to have BPH. When you come to our office at Caldwell Urology, we'll do some tests to diagnose you and see whether you have BPH. These include a medical history, especially something that's called an IPSS or AUA symptom index to quantify your symptoms. We'll do an exam of your prostate, which is a digital rectal exam, and we may do other medical tests, including a uroflow test to see how fast you empty your bladder, an ultrasound of your bladder to measure how much is left in you after you urinate, and maybe a cystoscopy or looking in your bladder to see what the anatomy is and how large the prostate is. All of this information we use together with you to figure out what the best treatment is. For those with mild, so treatment is one of four things: watchful waiting, medical therapy, minimally invasive surgical therapy, or surgical treatment. For men who have mild or not bothersome symptoms, we can control them with common sense behaviors like caffeine avoidance and timed urination. There are two types of medicine that are available. One is what's called alpha blocker, and the example is tamsulosin or Flomax, which is to relax the smooth muscle of the bladder neck and the prostate to improve urinary symptoms. The other type of medication is a 5-alpha reductase inhibitor, or finasteride is the most common. This medicine actually shrinks the prostate over months and can improve urinary flow and reduce the chance that you'll need to have anything else done. A combination of medications can also be used and may be slightly better than a single medication. Medications give just a modest improvement in symptoms, but are generally well tolerated in most patients with low risk of side effects. Men who don't want to take medications or who fail to improve with medications or have worse symptoms may be candidates for minimally invasive surgery. Now, there are many kinds of minimally invasive surgery, but the one that we do here at Caldwell is a prostate urethral lift, or UroLift, which is a procedure that can be done with IV sedation and local anesthesia. It's an outpatient procedure, and most men go home without a catheter. Men see improvement in their symptoms within a couple of weeks on average, and 85% of them can get off medication after the procedure. The chance of needing retreatment is about between 10 and 20% at 5 years. Now, when medications fail, then or there's severe symptoms, we often do surgery for BPH. Most prostate surgery for BPH is done through a scope. It's done under a general anesthetic in the hospital. These procedures offer the most improvement in urinary symptoms with the lowest risk of retreatment. In some patients, surgery is almost always recommended. At Caldwell Urology, we'd love to see you for BPH or any other medical condition. I'm Dr. Dave Cook with Caldwell Urology, a part of UNC Healthcare.